Hi, my name is Mark and I'm with Mercy Outpatient Therapy Services, and today we're going to be discussing some analogies that will help you through your healing process after your total knee replacement. The first analogy we're going to discuss has to do with swelling, and the analogy is having a bucket and having a hose. Your knee is your bucket and your heart is your hose. Anytime your bucket or your knee is below your hose or your heart, that bucket is going to be filling with water. So right after surgery, you're in a pretty large inflammatory state after your knee replacement. And the more you have your bucket below your hose, that hose is going to be filling your bucket with water. The more active you are with your bucket below your hose, the faster it's going to fill. So walking, standing, traditional, what you think of as low-level exercises, that's going to cause your knee to swell a great deal. Right after surgery, because of the inflammatory process, we have to manage that swelling by getting the bucket above the hose. So we're talking about laying flat on your back and getting that leg elevated with the knee straight, supporting the calf and the ankle so that knee rests in a straight position, but truly getting the leg above the heart. The more swollen you are, the more often you need to have your leg above your heart. The less swollen you are, you can spend more time in a chair like a recliner where the knee is even with the heart or the bucket is even with the hose. Again, still resting with the leg perfectly straight, but the knee's even with the hose. The less swollen you are, the better your swelling is managed. You can lay with your knee perfectly straight, but well below your heart. So the bucket is below the hose, you're sitting on the couch or sitting in a chair with the foot elevated, the knee is straight, but your bucket is truly below your hose. Right after surgery, because of the inflammatory process, this is something that may change from day to day. As your activity increases, your swelling may increase. You may need to spend a little bit more time with your leg elevated above your heart. As your swelling gets better, weeks down the road, you can spend less time with your leg above your heart. But right after surgery, you're going to be spending quite a bit of time working on that elevation. Now, of course, when you're elevating, you're also resting. And the four things we do to manage your swelling after surgery is rest, ice, compression, and elevation. So we've covered resting and elevation. Let's talk about ice. If I have that bucket of water and I wrap it in ice, it doesn't magically make the water disappear. It doesn't evaporate the water. So taking a swollen knee and leaving my knee below my heart, my bucket, underneath my hose, and just wrapping it in ice isn't going to get rid of the swelling that's already in my knee, right? It's just going to make it a very cold, swollen knee. Now, it may feel better, and that's okay, but it doesn't get rid of the swelling. Again, if I've got a bucket of water, wrapping it in ice doesn't help. I need to elevate it, get it above the heart. When ice is the most effective is after you've been active. We said the more active you are, the more you're going to swell. Well, it's the 20-30 minutes after you've been really active is when that knee slowly starts swelling. So right after you get done walking or being very active, having some functional activities, that kind of thing, that's when you ice the knee. Get on your back, raise your leg up in the air, ice it, and the ice will prevent the knee from swelling. You could think of it as freezing the little hoses that are filling the bucket. It's not going to let the water get into the knee. So ice is a preventative measure to stop the knee from swelling right after you've been active. It doesn't get rid of the swelling that's already there. So rest, ice, elevation. Last thing we have is compression. Not everybody needs compression right after total knee replacement. In fact, for some people, based on their medical condition, compression may be a poor choice to do. So your doctor and your physical therapist will help you decide whether or not you need compression on your leg. But everybody can do the rest, everybody can do the elevation, and everybody can do the ice appropriately. In addition to rest, ice, compress, and elevate, you can work on some low-level activities several times throughout the day that will help fluid move throughout the body. These are your ankle pumps, where you pump your ankle or foot up and down. Your quad sets, where you tighten up your thigh. Your gluteal sets, where you just squeeze your butt together. And your diaphragmatic breathing, where you breathe in and your stomach expands, and you breathe out and your stomach relaxes. These low-level activities, along with the rest, ice, compress, and elevation, help manage your swelling. So the next analogy that we're going to discuss has to do with motion or stretching. And the analogy that we're going to use is boards and glue. If I have two boards and I put some wood glue in between them and I sit those boards still long enough, eventually they're going to stick together and you're not going to be able to pull them apart. So how does this relate to your total knee? Right after your knee replacement, your body is going to be sending a lot of scar tissue to the area because that's part of the inflammatory process, which is normal and good. That's what allows that incision to close. But you've got to realize after the surgery, you're going to have scar tissue produced from the front of your knee to the back, from side to side, and from top to bottom. It's a three-dimensional scar tissue because of what they have to do to replace your knee. So as scar tissue heals, it gets stiffer and tighter and stiffer and tighter and stiffer and tighter, very much like that wood glue. So let's go back to the analogy. If I have these two boards in this wood glue, and every hour I kind of move the boards around on each other a little bit, nice and gentle. I don't have to try to rip them apart, but if I'm just gradually moving those boards throughout the day, by the time that wood glue dries, my boards aren't stuck together. So in the first couple weeks after your total knee replacement, what we recommend is that on a frequent basis, almost a few minutes every hour, we want you to bend your knee. You're going to be resting with it straight, but then for that 5 to 10 minutes an hour, we want you to gradually bend your knee, gently. It's kind of a low load, longer duration stretch. If you can't tolerate the stretch for about 30 seconds, then you're probably cranking on it a little bit too hard, okay? Now, we believe that the purpose of the knee is to bend and straighten. The reason God gave us a knee is because He wanted us to be able to bend and straighten halfway between our hip and our ankle. Otherwise it'd just be one long bone, right? So getting that motion back in your knee, resting with it straight to get the straight, but then every hour working on the bend is extremely important after your surgery because that scar tissue is healing, just like that wood glue. And within the first 4 to 6 weeks, if you haven't achieved good motion in your knee, it's going to be extremely hard for you to get it. Just like that wood glue just clamping those boards together, it's going to be hard to break them apart. So you've got this golden window of opportunity right after surgery in the first 4 to 6 weeks to gain quite a bit of motion in your knee through gentle progressive stretching several times a day. So the next analogy we want to discuss has to do with surfing. See, waves are constantly traveling and they're constantly moving toward shore. They don't sit still. Your body is constantly healing. Every day it's a little bit more healed, a little bit more healed, a little bit more healed. Your job is to stay on your wave and surf that wave. If you get too aggressive with your function and you're on your feet a little bit too much, your bucket is below your hose a little bit too much, you're doing a little too much exercise, you're going to get out in front of your wave and you're going to be working at a level of intensity with regard to function that your body will be ready for maybe in a week or two. Not today. And you're going to get out in front of your wave and you're going to sink. With regard to stretching and motion, if you're not stretching quite enough to make little gains every day in your motion, your body is healing, but your knee's not improving. So how do you know if you're staying on your wave? Well, first things first is we have to manage our swelling, keep our swelling down, which means we have to keep our function at a level that we can tolerate it. The next thing is we need to work on that motion. So every day we're gaining a little bit of motion. You know if you're on your wave, if your swelling is improving gradually and your motion is improving. Don't measure your progress by how well you function, how far you can walk, how strong you are in the first couple weeks out after surgery. That's a good measure several weeks down the road, a few months down the road. But to stay on your wave during the healing process, manage your swelling, manage your motion. The next thing we're going to discuss is pain management. See, everybody has a 0 to 10 scale. And a lot of my patients are like me, and we like to think that we're pretty tough, and we can push ourselves to a 7 or 8 on that 0 to 10 scale if we need to. So that makes me pretty tough. Well, the reality is where my 0 to 10 scale is compared to someone else's, I don't know that. And that is not something I get to choose. I can choose where I'm at in my pain scale, but I truly can't choose if I have a high threshold for pain or a low threshold for pain. That's something that's set genetically. You don't get to pick that any different than your eye color, your hair color, or your height. So some of our patients after total knee replacement may be kind of in the middle, and they're going to need a certain level of pain management to be able to tolerate getting the motion back in that knee and stretching the knee enough to make gains throughout the day. Some of our patients are going to require quite a bit of pain medication to tolerate what they need to tolerate to get that motion back into the knee. The purpose of the knee is to bend and straighten. Some of our patients may not need much pain medication because genetically they were born with a high tolerance for pain. So they may not need as much pain medication to be able to stretch enough to get that motion back in their knee. See, measure whether or not your pain is under control based on, is your knee bending a little bit more every day? It's not that painful to actually work on function and walking. It's not that painful to rest and work on your low-level activities like ankle pumps and that kind of stuff. So sometimes our patients will be off their pain medication a little bit too early because function doesn't bother them and resting doesn't bother them, but getting the motion back does hurt. So they're not spending enough time stretching the knee, and their knee gets stiff, and we lose the purpose of the knee. So base your pain tolerance on, can I gain a little bit more motion into my knee every day? If you happen to be the person that doesn't require much pain medication, fantastic. If you're the person that does require quite a bit of pain medication, fantastic. There's no shame in that whatsoever. The pain medication is a tool for you to be able to do what you need to do to recover well. The last thing we're going to discuss is what I like to describe as the 4 dials of recovery. So you have 4 dials of recovery, and the first dial has to do with swelling. The second dial has to do with stretching, or getting the motion back in your knee, the bend back in your knee. The third dial has to do with function, walking, being up and around. And the fourth dial has to do with true strength. Let's focus on those first 3 dials. And in the first couple weeks after your knee replacement, you're going to want to focus on those first 3 dials. Right after your total knee replacement, your body's going to be going through a massive inflammatory response. So you're going to have that dial on swelling turned up quite high. We like to kind of start off with about 45 minutes at every hour. You're going to spend your time working on rest, ice, compress, elevate, the low-level exercises like pumping your ankle and squeezing your butt, diaphragmatic breathing, tightening up the thigh, the low-level stuff. You're just chill for that 45 minutes out of about every hour. In about 5 to 10 minutes every hour, we want you to gently stretch the knee. Take it to a point to where you can hold that knee for about 30 seconds or so. And just hold it. Focus on your breathing. Nice slow inhale, even a slower exhale. Breathe in for 4 seconds, breathe out for 6, and hold that stretch enough that every day you're gaining a little bit of motion in your knee, because the purpose of the knee is to bend and straighten. You're resting with it straight, you're working on stretching to get it bent. And then with regard to function, walking, standing exercises, being up and around, what you would traditionally think of as your physical therapy exercises, we want to have that dial turned down real low to start with, because the more your bucket is below your hose and the more active you are with your bucket below your hose, the more it's going to swell. Now we're back to our first dial. This is more important to start with. So start with that function dial at about 3 to 5 minutes an hour. And when you're working on function, work on moving better, not moving more. It's more important for you to walk with perfect form than it is to walk further or faster or more. I can have the tires on my car turned inward with the alignment in horrible condition and still drive across country. But I'm not doing myself any favors. It's more important to make things move better first, and then I can move more. Your body has to earn the right to move more. So that function dial is just a few minutes every hour, 3 to 5 minutes every hour, And the point of that is to teach your body and teach your knee how to move correctly. Strength is something that we're going to work on several weeks down the road. Right after your knee replacement, and they take one of the largest joints out of your body and replace it, you don't want to put a lot of stress and pressure and force through that knee. You want to focus on managing your swelling, gradually getting your motion back, riding that wave of healing, gradually turning up your function, maybe 1 to 2% a day, and eventually getting to strength. I hope these videos have helped kind of put your mind in a state of mind like our mind would be if we were to go through a total knee replacement. I hope they've been educational for you. I hope you take them to heart, and we wish you the best. Look forward to seeing you.